This short video will explain how to do a clinical reasoning case on TeachingMedicine.com. After you log in, click on DX and select Develop Your Skills. You will see a case library and you can choose one of the cases to do. Click on that case. We're going to show you how to navigate through one of the diagnostic cases. On the introduction page of the case, there is the chief complaint, and all you need to do on this first page is to type in one diagnosis that you think would be appropriate for the differential. Click Next, and now you're on the history page. This page shows a full detailed history, and you'll notice that multiple pieces of data within the history are highlighted. These items you can interact with, and for any item that is appropriate for your differential diagnosis, you click on it and click on the appropriate box to indicate whether this data increases or decreases the probability of this diagnosis. For example, pain in the right lower abdomen would increase the probability of appendicitis. You will inevitably think of other diagnoses to include in your differential, and at this point in time you can add any of these diagnoses that you like, up to a maximum of 5 diagnoses. You will then completely analyze the history, assigning all relevant data to the appropriate green or red boxes. You should not assign all of the data because some of the data will not be relevant. When you're finished analyzing the history, click on Next, and you will be shown the physical exam. The physical exam is the same as the history. You go through and analyze the data, and when you're finished, click Next, and you will be on the investigations. I've already added some investigations, and what you do is click on the box up here, and if you want, for example, a chest x-ray, you order it and then get the results. You can show the results and then click on any relevant data that's within those results to your differential diagnosis. If you've ordered blood work or lab work, those results will also be shown, and you can click on any of the data. For example, a white count, a normal white count, would decrease the probability of appendicitis. You can click on the name of the diagnosis at any time to see what data you've added, and if you made a mistake, you can delete that data. After you have ordered your investigations and analyzed the results, you go to the very last screen, which is classifying your final diagnosis. You must choose a most probable diagnosis, and as an option, choose a less probable diagnosis. You also need to indicate your level of confidence in your diagnosis, and then when you're finished, click on Complete Case and see Stats. There is a maximum of 5 diagnoses that you can populate into your differential. There is a maximum of 15 data points that you can put in each green box or red box. This is designed on purpose so that you don't just spam a whole bunch of data into the box, and that you have to carefully think about which data actually increases or decreases the probabilities of these diagnoses. You should add at least 4 appropriate diagnoses to your differential diagnosis. You will earn points up to a maximum of 4 for your diagnoses, and if you put in a diagnosis that is super rare or inappropriate, you will not score any points. When you work through the history, the physical exam, and the results of the investigations that you order, make sure to click all of the data that is relevant to the diagnoses in your differential. Don't forget to click on the pertinent negative data as well. For example, if your patient had no fever and a normal white blood cell count, and you had some type of infection in your differential diagnosis, these two pieces of data would be important pertinent negatives. Do not click on data that is neutral or useless, because you do have a limit to how much data you can click into each box, and you want to only select the high priority data. When you are ordering investigations, don't order too many investigations, otherwise you might lose points. Every time you click on the Get Results button, this adds 1 round of investigations. So you don't want to order too many rounds of investigations, because you can also lose points. This means that you have to make a decision about how many investigations you want to order in the first round, how many you want to order in the second round, and so on. If you order an investigation, you need to use the data in the results of your investigation to click on something in your differential. If you order a test and you don't use the data, then you need to step back and ask yourself, why did I even order that test? And you will be penalized. You'll lose a small number of points if you order a test and you don't use or click on any of the results from that investigation into your differential diagnosis. Scores for a case are generated in 4 different categories. How appropriately did you populate your differential diagnosis? How thoroughly and appropriately did you analyze the data in the history and the physical exam and the investigations? And how well did you use that data to support the items in your differential diagnosis by clicking that data into the green and red boxes? There's a separate score for how appropriately you ordered investigations and used the data. And of course, the final ranking of your diagnosis. Which diagnosis did you choose as the most probable diagnosis for this case? There are points attached to that step as well.